Ladies and gentlemen, let's settle down and restart our agenda. And by the way, I did not see anybody exercising, so that's not a good sign. Coming back to our interventions, I would request Canada to please take the floor, followed by Tanzania. Do you want to wait?
Thank you, Chair. There's been significant progress made in the implementation of the Health Emergencies Program. This includes WHO's response to outbreaks and emergencies, for which the Contingency Fund has been a critical yet underfunded tool. Much of the progress can be attributed to the high level of commitment of the WHE staff. However, this is not sustainable without the requisite underpinning systems and processes. And we agree that WHO must undertake a harmonized organizational transformation agenda rather than a fragmentary reform or the introduction of a parallel system for the WHE program. However, strengthening systems for staff security, as well as the development of flexible contractual arrangements to support personnel deployments, are urgent and should draw on the best practices of the Interagency Standing Committee members. Canada supports the decision points to endorse the 5-year Global Strategic Plan to improve public health preparedness and response, and to continue to report annually to the Health Assembly on IHR implementation using the self-assessment annual reporting tool. We welcome the continued momentum with regard to IHR capacity building and the use of the joint external evaluations to help improve public health preparedness and response, as well as the importance of linking these efforts with health system strengthening. Canada is currently preparing to receive a joint external evaluation team in June of this year, and as a federated state, I can tell you that the ongoing collaborative work between our federal government and those of the provinces and territories within Canada has been very promising and very positive in reviewing our current capacities, identifying what is working well and areas where we could continue to strengthen our preparedness. Overall, this process is providing great opportunities for relationship building and to strengthen cooperation, coordination, and collaboration across all sectors in our country. Finally, Canada encourages the WHO to work with volunteer member states at the working or technical level through consultations or task teams when developing new guidance or tools in support of the deliverables outlined in this strategic plan. This could be a great opportunity to leverage the experiences of member states and their lessons learned in implementing the IHRs. Thank you.
Thank you, Canada. And I, for one, really empathize with the challenges which the Federation faces when the provincial governments have to be aligned for a single agenda. So I appreciate your efforts. The next speaker would be from Tanzania, to be followed by Jordan. You have the floor, sir.
The United Republic of Tanzania aligns itself with the statement made by Zambia on behalf of the 47 Africa member states. We also share the vision of the Director General in addressing health emergencies as one of the 3 strategic priorities for the WHO in the General Program of Work 2019 to 2023. Time and again, continents experience public health emergencies, resulting in increased morbidity and mortality. Mr. Chairman, several countries across continents are already struggling in the development and provision of adequate universal health care needs to their populations. As we have experienced over the years of human existence, the occurrence of natural disasters, industrial accidents, civil unrests, sometimes compounded by epidemics of communicable diseases, affect communities both socially and economically in a despicable manner. Attention is drawn to the need of a multi-sectoral approach to accelerate international health regulations and tackle the global health security agenda by working beyond just the health field. This multi-sectoral approach connects the broader perspective of planetary health security, a concept that integrates human health, animal health, and environment sustainability, which is timely in its relevance to universal health coverage and sustainable development of the human race. Mr. Chairperson, to enhance coordination on global health security and universal coverage investment coordination, we would like to encourage all stakeholders to use the WHO Strategic Partnership Portal for international health regulation. The strategic Partnership Portal can facilitate the sharing and exchange of information on current and future health security activities and investment, while allowing member states, partners, and donors to find synergy for better coordination and sustainable partnership. Lastly, we support adoption of the proposed decision. We thank you.
Thank you very much, sir. May I now invite Jordan to take the floor, and then that would be followed by the honorable delegate from Brazil.
Mr. Chairman, the Kingdom of Jordan feels that preparation is of capital importance because there are a lot of Syrian refugees in our country, and today they represent 15% of the Jordanian population. They are spread throughout all regions of the country. 85% of the refugees live with Jordanian society. There are camps that on the border, and they include 70,000 refugees. Even if we have excellent health systems, we are very afraid of the transfer of illness, especially since the beginning of the refugee crisis, which has seen epidemics. For example, there has been poliomyelitis spread. Our aim, obviously, is to improve our preparedness so as to be able to face any emergency. This will require the assistance of the WHO and other international organizations. Thank you, Chairman.
Thank you, Jordan. Brazil and then Italy.
Thank you, Chair. I'll speak first on the first sub-item under this item. And in that respect, we thank the Independent Oversight and Advisory Committee for its report. It's important to recognize the consolidation of WHO as a central entity in coordinating and leading partners in the tough work in the prevention, preparedness, and response to health emergencies. On the other hand, the report also acknowledges the existence of administrative hindrances related to administrative systems, business process, and human resources that prevent excellence in the emergencies program. A seamless organizational shift in WHO, as proposed by the GPW 13, may provide us with more adequate solutions to those issues before considering alternatives such as having a parallel exclusive system to the WHEP. We would also invite comments by the Secretariat on the IOAC reference to a lack of information and insufficient accountability in respect to the supply chain, which might lead to inefficiency and waste of valuable medical products. Thank you.
Thank you, Brazil. Italy, you have the floor, to be followed by Swaziland.
Thank you, Mr. Chairman. Italy shares the Netherlands' consideration on paper 1, but my statement will focus on papers 2 and 3 concerning the emergency, in particular those ones related to large influx of refugees, asylum seekers, and migrants, as underlined by the Honourable Delegate of Jordan. As stated by the DG, we have to face 4 urgent needs. First, better policies that promote these people's right to health, address their health needs, and integrate them into their host societies. 2, health systems able to address their needs. 3, improving data collection and monitoring on health status and needs of refugees, asylum seekers, and migrants. 4, strengthening collaboration between countries and sectors to better manage the health needs of refugees, asylum seekers, and migrants. Italy fully agrees with these goals and wants to share its know-how and knowledge in supporting WHO to reach them. According to this, in particular, we need to improve preparedness of countries towards large-scale migration. The health systems in the countries receiving migrants need to be well equipped and experienced to diagnose and treat the most frequent health problems, as well as be prepared to provide appropriate health care to refugees, asylum seekers, and migrants. Under the International Health Regulation 2005, all countries should have effective disease surveillance and reporting system and capacity for outbreak investigation, case management, and response. Access of vulnerable groups such as young children to acute care for common and severe conditions must be assured, as children's health can deteriorate quickly if they do not have adequate care. The example of WHO European region and Italy can be considered a good starting point. Italy faced health challenges and urgencies addressing both middle and long-term public health implications of migration, strongly working hand-in-hand with WHO, Euro and other countries. In particular, I want to thank Dr. Susanna Jakob for the strong and effective leadership that allowed WHO Europe to build a long-time strategy in Europe on migrant health, asylum seekers and refugees, firstly with a project, then with a structured program based on 4 pillars: policy development, health information and evidence, technical assistance, advocacy and communication. Today, the crisis can be also considered an opportunity to reconsider and implement new approaches and policies focused on refugees, asylum seekers and migrants' health. To conclude, in the next few years, WHO will need to focus on the following issues. 1, ensuring access to healthcare, vaccination, safe water and food, and therefore to a decent life and a better life perspective. 2, systematization of common approaches targeted on migrant health. 3, promotion and support of a common definition of undocumented migrants and labor migrants. 4, normalizing, between commas, the management and the governance of migrant health care. 5, improved collection and quality of health data. 6, promoting best practices already in place, WHO Euro Office Italian guidelines. 7, promoting inter-country coordination and collaboration to align the agenda for member states through coordination meetings, such as the ministerial lunch on migration that will take place during the next 68th Regional Committee for Europe in Rome next September 2018. Thank you.
Thank you, Honourable Delegate from Italy. May I now request Swaziland to take the floor, which would then be followed by Vietnam.
Thank you very much, Mr. Chairman. The Kingdom of Swaziland, first of all, aligns itself to the statement made by Zambia on behalf of the Africa region. Swaziland welcomes and appreciates the report of the Director General. Globalization has led to the increased threat of cross-border transmission of communicable diseases. The comprehensive implementation of the International Health Regulations reporting mechanism ensures the operation of a seamless global disease prevention network. The WHO should ensure direct, quick, and obstacle-free communication with all IHR focal points so that all countries are in a position to make real-time exchanges of information on epidemic outbreaks and to respond to communicable diseases. We affirm the Secretariat's approach and request that this excellent mode of IHR implementation be continued. Mr. Chairman, in this respect, the Republic of China on Taiwan, given its medical expertise and experience, can certainly contribute to the global health security. We would like for Taiwan to continue its professional, pragmatic, and constructive participation in WHO mechanisms, conferences, and activities. Since being incorporated into the IHR mechanism in 2009, the Republic of China on Taiwan has sent epidemic reports to and engaged in IHR implementation matters with its WHO focal point directly, but unfortunately has not been afforded any feedback to those reports. This is not good for the nation's health, for that nation's health as well as global health. As Taiwan lies at a key position along transportation routes in East Asia, it is frequently visited by international business travelers. This makes it vulnerable to cross-border transmission and the cross-transmission of communicable disease pathogens, which could lead to their genetic recombination or mutation and give rise to new infectious agents. Because Taiwan is not a member of the WHO, there is a significant delay before it is able to acquire disease and medical information, which may or may not be accurate and complete. This negatively impacts the global health system and people's rights to health. The continuing sidelining of Taiwan from participation on global health matters does not only deprive the people of Taiwan their fundamental rights to health, but also robs of the entire world excellent contribution from cutting-edge expertise from Taiwan. Swaziland submits this request for your favorable consideration. and we support the draft strategic plan and the decision. I thank you.
I don't want to. Okay. I would now request which one is the country? Vietnam to take the floor, please, followed by Philippines.
Thank you, Chair. Vietnam acknowledges the effort of WHO Secretariat for the well-prepared and informative report on the public health emergencies of international concern, WHO's work in health emergency program and global implementation of the International Health Regulation 2005 for the year 2016. It is extremely impressive that the reports emphasize fully progresses achieved as well as challenges faced in 2017 of WHO's Health Emergency Program and IHR 2005 implementation. It also mentions the draft 5-year global strategic plan to improve public health preparedness and response. Mr. Chair, Vietnam appreciates WHO's strong coordination and leadership role and support under the WHO's Health Emergencies Program in response to a variety of infectious diseases and public health emergencies in recent years. A significant progress has been achieved in the implementation, particularly in enhanced structure, speed of event verification, risk assessment, communication, and IHR implementation, as well as the huge effort to adapt the incident management system to the different contexts of crises. In this regard, we are pleased to share that the Ministry of Health of Vietnam established the MOH Public Health Emergency Operations Center, PHEOC, to prepare needs and respond to health emergencies. In addition to that, PHEOCs at regional level have been also established to form a network in order to respond health emergency at local level as the first time. These PHEOCs follow the model of WHO's framework for the PHEOC, which was issued in 2015 and has been adapted to the real situation in Vietnam. Based on the JEE recommendation, Vietnam is in the process of developing the national IHR master plan using the upset framework as a guidance. We strongly support for early endorsement of 5-year global strategic plan so that the member state could use as a further guidance for completion of the country IHR implementation plan. Vietnam fully agrees with the Secretariat's finding in relation with important challenges that must be addressed, which include upgrade the business processes to support emergency response effectively, enhance information sharing and communication with WHE for both international and external audiences, strengthen resource mobilization capacity at country level, develop and validate SOPs in the health emergencies. Chair, Vietnam commits to continue maintaining and strengthening the PHEOC network and take fully required responsibility as an active state member. Thank you, Chair.
Thank you, Delegate from Philippines, and I would now request, from Vietnam, I would request the Honorable Delegate from Philippines to take the floor, to be followed by the Delegate from Japan.
Thank you, Chair. Philippines thanks the Secretariat in providing comprehensive documents on public health preparedness and response, namely 142.9 and 142.10. We specifically note the progress on research and development in the context of emergencies and looks forward to the publication of a methodological guidelines, decision-making tools, models, and generic protocols to evaluate vaccine efficacy during outbreaks. On regulatory capacity, we support the planned WHO initiatives to partner with countries in strengthening national regulatory and ethics bodies to respond to public health emergencies. In particular, we support the improvement of the regulatory preparedness to address public health emergencies for vaccines, diagnostics, and therapeutics for priority pathogens. Further, we appreciate the report prepared by the Secretariat and fully supports the draft 5-year Global Strategic Plan for 2018 to 2023, as well as the adoption of the proposed draft decision. Recognizing the importance of the 3 pillars of the strategic plan, we welcome the continuous support from WHO in building maintaining and strengthening IHR core capacities of member states. Specifically, we are hopeful that the conduct of the joint external evaluation in the Philippines by WHO will result to improvements in terms of integration of core capacities of regulation to our national health system and financing, especially during emergencies and disasters. Likewise, we believe that the establishment of a region-wide surveillance system under Pillar 3 will allow member states in each region to share available information on priority emerging diseases for disease control and policy development. Lastly, we look forward to the revised self-assessment and annual reporting tool as one of the deliverables of the strategic plan in June of 2018 to more effectively measure progress of member states and promote accountability. Thank you.
Thank you, Philippines. I would request the delegate from Thailand to take the floor, followed by Colombia and then Japan.
Thank you, Chair. Thailand would like to comment on the document EB 142/10. We note the consultative processes in developing the global strategic plan through regional committees, web-based consultation, and informal consultation in Geneva. Our main concerns are the deliverables and indicators in the plan, which are the benchmarks for the HR achievement. They were not available for discussion at the regional committee and also the web-based consultation. All of the 14 indicators, one-fourth are meetings, which are outputs. Only a few are real outcomes. In addition, they don't have clear time-bound targets to achieve. Thailand would like to see the deliverables and indicators to include key common challenges, including but not limited to the capacity of IHR national focal centers, the cross-border strategies, the trust-based horizontal networks, for example, the MBDS and the courts, and the proportion of IHR manpower and distribution. We would request the WHO to convene a comprehensive consultation focused on the clear, concrete, time-bound deliverables and indicators between the EB 142 and the WHA 71. The WHO should devise a regular, independent, transparent, and objective assessment mechanism to evaluate country performance against the benchmarks and indicators, building on the IHR existing tools and global health security agenda assessment pilots. Mr. Chair, the success of implementing this strategic plan would help ensure that the vision of building global armies of disease control experts can really be achieved. Thank you.
Thank you, Thailand, Colombia, and then Japan.
Thank you very much. We'd like to thank the Secretariat and management for the consultation as held and then the development of this 5-year plan. We welcome the efforts undertaken to receive and incorporate the comments from member states. Strengthening the World Health Organization is a clear decision of the Director General, and the commitment to accompanying countries is crucial in response to disasters and the application of the IHRs. With regards to measuring progress and accountability, we welcome the work done by the organization to include the recommendations set forth in the development on voluntary assessments. We think this can allow countries to strengthen their response capacity and to identify, perhaps the most important thing, ways to improve. What is a priority is strengthening countries' preparation to deal with health emergencies in the context of the IHRs. I'd like to draw your attention to the need to increase incentives for the appropriate implementation of the IHRs by countries considering strategies such as technology transfer, knowledge transfer, and support, for example, for epidemiological research. We believe what is also relevant is to identify mechanisms for information which could improve exchange of data. Looking at the normative basis each country has as well and to deal with such disasters. Take into account the economic situation in the world at the moment. This is a crucial element to ensure that countries that can make progress on complying with their commitments deriving from the IHR. So undertaking the necessary actions and developing them to strengthen mechanisms for preparedness and response in global public health is important. Thank you very much.
Thank you, respected delegate from Colombia. Now I'd request Japan to take the floor.
Thank you, Chair. I would like to comment on IOAC report and the 5-year global strategic plan. First, on the IOAC report. Japan welcomes the IOAC report and notes with pleasure that many health emergencies have been managed. Also, we note that WHO is now dealing with significant number of proactive or war conflict-related emergencies. The report highlighted several important challenges such as complexity of administrative processes, inadequate mutual understanding among 3 levels of the WHO, and a danger of the Contingency Fund for Emergency, CFE, is drying up. We would like to hear from the Secretariat how this important mechanism to be preserved. Second, on draft 5-year global strategic plan. We welcome the draft 5-year global strategic plan. It has been proposed in full consideration and harmonization of the existing framework and of some regional frameworks, such as Asia-Pacific Strategy for Emerging Diseases, jointly developed by UPRO and CRO. We are also happy to see that the indicators of the timeline for assessing the progress in the 5-year plan has been clearly set. It will be even better if what the Secretariat do, what the member countries do, and what to do jointly are displayed more clearly. Third, on IHR and JE. In order to reinforce the capacity to cope with health emergency, Japan welcomes the plan assisting more countries to observe IHR and to meet more capacities. Also, we strongly support the direction that the WHO will, utilizing the JE's assessment support with priority the countries of significant vulnerability and with an insufficient IHR core capacity. In this context, we wish to encourage WHO to further enhance collaboration with the World Bank. Fourth point is linkage between UHC and emergencies. At the Tokyo UHC Forum, we reconfirmed the preparedness for health emergency is also of an important component in building a resilient health system for achieving UHC. We also reiterate that to improve preparedness, allocation of domestic budget in a sustainable manner will be put in priority by including the plan in each roadmap or national health strategy. I wish to stress this point. Also, as the world has become more globalized and the threat of infectious disease that may spread beyond borders has been increasing, we assume that we should not make geographical blanks by leaving a specific region behind. Thank you.
Thank you, Japan. May I now request Jamaica to take the floor?
Thank you, Mr. Chair. I'd like to comment on item 142.10. Chair, Jamaica wishes to commend the WHO Secretariat on the report of the Public Health Preparedness and Response and the development of the draft 5-year Global Strategic Plan. CARICOM member states support the draft Global 5-year Strategic Plan to improve public health preparedness and response to public health emergencies of national and international concern. We welcome the framework for the development of the international health regulations outlined in the 5-year plan with its 3 strategic pillars and outlined objectives. We anticipate that the implementation of this plan will strengthen our capacity to detect, contain, and report on public health emergencies. We support the request to the Director General to provide the necessary financial and human resources to support the implementation of the plan. We endorse the use of the available monitoring and evaluation instruments and request that CARICOM member states be included to participate as evaluators in joint external evaluations, as this provides us with the insightful information to improve our core capacities. We also request that the existing monitoring tool for the assessment of the core capacities be maintained in addition to any other monitoring evaluation framework developed for overall evaluation of the global strategic plan. Thank you.
Thank you, Jamaica, and I believe Japan do not want to make another intervention. So as there are no EB members, we'll move to non-EB members, and I'll request the delegate from Nicaragua to take the floor, followed by the delegate from Honduras. You have the floor, sir.
Muchas gracias.
Thank you, Chairman. I'm going to refer to the 3 documents. As part of the model for health, family and community health, which is being supported by the Government of National Reconciliation Unity, which is of which the President is Daniel Ortega Saavedra, through the Ministry of Health, our government has made health a priority for Nicaraguan families, which has allowed us to improve and expand health services and bring them closer to Nicaraguan families. We have obtained positive results, which are well known with regard to reduction in disease and death. Chairman, globalization has led to an increase in the transmission of contagious diseases, and this means that the absence in any region of the global health network creates a gap which has implications, risks, namely, for human health. That is why the government of Nicaragua believes it is very important and necessary to include Taiwan in the global health security system, since, with their knowledge and medical experience, they should continue to participate in a professional manner in the work of the WHO. Finally, Chairman, I would like to say that the government of Nicaragua is in agreement with the focus of the Secretariat of the WHO, and we'd like to request that it continues with its good practices. Thank you.
Thank you, sir. I would request Honduras to take the floor, to be followed by Australia.
Muy buenas tardes.
Good afternoon, Chairman. For the sake of time, the 3 documents will be dealt with in one single intervention. We support the report of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Programme, which covers the application of the framework, the emergency response framework, and the classification or grading of emergencies, and the system for health emergencies management, and the response system. It's a solid coordination function and health coordination which supports our governments jointly with organisations and other international cooperation actors. This supports the establishment of an ongoing surveillance system for public health emergencies. Its application has established new agreed interventions to deal with pathogens and epidemics which are very important, such as the Zika virus, which was identified in Honduras in 2016. The implementation of the notification system for IHRs, which is included in the National Health Plan to improve the preparation for and a response to global health public health issues. What's being requested here is that support continue to be provided to member states so as to expand their capacities in implementing the IHRs, including mechanisms which facilitate fluid and articulate communication with contact points for IHRs. Now, turning to national health approaches, what is important is exchange of information on outbreaks and interaction on such issues. Thank you very much.
Australia to be followed by USA. You have the floor, Australia.
Thank you, Chair. Australia thanks the Independent Oversight and Advisory Committee for its 3rd report and congratulates WHO for the progress to date in implementation of the Health Emergencies Programme. We note the challenges outlined in the report and urge action on the recommendations, many of which have resonance and are aligned with WHO's broader reform agenda. We also encourage improvements in communication, including a more even approach to reporting information and emergencies for all WHO regions. Australia recognises the critical leadership of WHO in assisting countries to prepare for and respond to health emergencies. We acknowledge the scale and scope of this work and commend the ongoing commitment of the organisation to addressing health security threats globally. We also reiterate our support for the full implementation of the IHRs as the foundation for global health security. In the interest of time, we will not intervene again on this agenda item, but I'd note our strong support for the endorsement of the 5-year Global Strategic Plan to improve public health preparedness and response contained in document EB 142/10. Chair, Australia is a strong supporter of the Health Emergencies Program and is pleased to lead by example in providing unearmarked, multi-year contributions. Last year, we announced the commitment of $20 million over 5 years in unearmarked funding through Australia's Health Security Initiative for the Indo-Pacific region. We encourage others to consider doing the same to ensure the program's financial sustainability going forward. Thank you, Chair.
I would request the delegate from USA to take the floor, to be followed by El Salvador.
Thank you, Mr. Chairman. We're going to combine our remarks on the 3 papers, and hopefully we will stay within your time limits. The United States welcomes IOAC's second report to the EB. We share IOAC's concern that administrative systems and business processes must be prioritized and standardized across regions for continued success. We reiterate the importance of using joint external evaluations and the development of multi-sectoral national action plans to drive country-level preparedness, response capacity development, and health system strengthening. We agree with IOAC on the importance of improving reinforcement and familiarization of standard operating procedures to include the emergency response framework. We would like to know what WHO is doing to ensure consistency in implementation across regions and countries. We appreciate IOAC's field visits and encourage it to visit challenging settings for emergency response, such as Yemen and South Sudan. We echo IOAC's recommendation that the Health Emergencies Program share the emergency dashboard with donors and the public, and to share the draft corporate investment case with member states. The United States is pleased to see WHO increase field presence to address critical gaps in responses to outbreaks and emergencies in the Africa and Eastern Mediterranean regions. We congratulate WHO on improvements made in the Health Emergency Program. We would like to know more about administrative improvements and lessons learned from recent responses, such as in Yemen and Madagascar. We encourage WHO to conduct rigorous and transparent after-action reviews of major outbreaks and emergencies with input from external experts. We're encouraged to see the development on the research and development blueprint and urge WHO to continue working with all partners to appropriately incorporate blueprint topics into emergency contexts. Full implementation of the international health regulations is an obligation of all member states, and supporting these efforts is a core function of WHO. This new draft global strategic plan provides a strong platform for success, and we support the decision point as drafted. The plan's multi-sectoral engagement and coordination is key to national planning. We encourage countries to consider the role of sectors outside of health in their budgeting and financing discussions for pursuing health security. We underscore the continued importance of biosafety to our IHR efforts and need to mobilize national and international human and financial resources to improve laboratory biosafety. The report on WHO's work in health emergencies is at the very heart of what WHO does every day in protecting and saving lives in emergency settings. In this world of disease threats, defying and crossing borders, debates on public health preparedness and response are by nature inclusive and universal. Thus, the ability of the people of Taiwan to share their experience and coordinate in public health on such relevant debates through simply observing at the World Health Assembly is simply the right thing to do, and we hope it receives an invitation. Thank you, Mr. Chairman.
Honorable delegates, I have been advised by the legal counsel to advise all the speakers to restrict themselves to the topic and ensure that whatever they're speaking is relevant to the topic under discussion. We would not like to interrupt any speaker for this particular issue in future. Now we'll move on to the next speaker, and that is El Salvador, to be followed by Germany.
Thank you, Chairman. Our delegation is speaking on all three documents. Starting from 2009, El Salvador identified the gaps that we had as a country in order to be able to have the 13 basic capacities established under the IHRs. Based on these gaps, we drew up a plan which has been implemented since 2013, up to nearly 90%. A technical committee was created on an interinstitutional level, which included the Ministry of Agriculture, the Civil Aviation and Maritime Authority, the Environmental Ministry, and other entities. Annual plans have been established since 2013 in order to underpin the basic capacities which have been developed. This includes our health surveillance system, which is recognised by PAHO as one of the best in the region. This, together with the unified information system for health, has allowed us to be successful in the control of viruses such as chikungunya, Zika, and yellow fever, and also measles. We're aware that given the different situations that exist in the health arena, we need to be able to have the effort of the entire international community to react. That is why our country, for the sake of the principles of inclusion, universality, and not leaving anybody behind, supports the request submitted to this organization by Taiwan to participate as an observer, with the aim of having professional and effective participation in the international health system through the Health Emergencies Program to unify itself, to join international efforts to achieve Sustainable Development Goals adopted for the 2030 Agenda. Thank you very much, sir.
Which one is next one? May I now request Germany to take the floor, which would be followed by Germany. Republic of Korea. Yeah, Republic of Korea. Germany, you have the floor.
Thank you, Chair. Germany fully aligns itself with the statement made by Malta on behalf of the EU. I would like to comment on the first two documents. Germany would like to thank the Secretariat for the comprehensive reports and commend the organization for the progress made in the implementation of the emergency program and its work at country level in health emergencies. Let me highlight a few aspects from which the revised document would benefit. We recommend to add information how effective WHO's work in health emergencies is at country level. And to add information regarding lessons learned and after action review from WHO's recent health emergency operations. We would appreciate further details on WHO's operational approach in conflict-affected settings, including a reflection of WHO's role as humanitarian actor and its central position as humanitarian cluster lead. The report mentions the Memorandum of Understanding with CEPI. We would very much appreciate more information regarding cooperation at country level and how the division of labor is between the different UN organizations, including, for example, WHO's cooperation with the World Bank and PEF. An annex with cooperation partners should be added with concrete action in emergencies. What are the challenges, gaps? What would WHO do different in a different way next time? We recommend to add information regarding the use of the contingency fund for emergencies. Where, when, for which action, and by whom was the money used? Regarding the IOAC recommendations, we support them in general. We strongly support the recommendation for further efforts to embed transparent and proactive communication across the organization, including to make the dashboard available for external audience. We agree with placing emphasis that GEEs and developing national action plans should be considered as an opportunity to strengthen health systems. It is crucial that national action plans are aligned with overall national health strategies. Regarding the proposed staff distribution of 50% at country offices and 25% at regional office and headquarters, we would appreciate more information on the rationale for this proposed allocation. Germany is pleased to be the largest contributor to the contingency fund, and we would like to encourage others to contribute to this important instrument as well. A replenishing strategy is still needed in this regard. We would also like to see more detailed information about the EMT initiative, as this is a major component of the WHO emergency reform. Thank you for your attention.
Thank you, Germany. May I now give the floor to Republic of Korea, followed by Indonesia.
Chair, we welcome the IOAC report and appreciate the approach taken in producing it. The IOAC has been contributing to the development of the WHO Health Emergencies Program by monitoring the progress of its work and providing guidance and advice as needed. In general, we agree with the assessment indicated in this report and welcome the very timely and appropriate recommendations. As the report points out, the recent response by WHE to plague in Madagascar shows that there has been significant progress in the implementation of the program. However, we also agree that WHE still has many areas that need improvement in order to maintain its functionality. We are particularly concerned about the significant gaps in the recruitment of human resources, not only at the country level, but also at the regional and headquarter levels. In addressing this issue, we hope that WHO will take the appropriate steps, such as creating flexible contractual arrangement and strengthening WHO capacity of human resources planning and recruitment, as recommended by the IOAC. We highly value the critical role played by the WHO program in preventing, detecting, and responding to infectious disease. We hope that the IOAC can continue to work toward strengthening WHE through its well-functioning oversight role. Thank you.
I would give the floor now to Indonesia, followed by Haiti. You have the floor, Indonesia.
Thank you, Chair. Honorable Chair, Excellencies, ladies and gentlemen, Indonesia appreciates WHO Secretariat for preparing the draft of Public Health Preparedness and Response for WHO's work in health emergencies. Indonesia acknowledges that WHO Health Emergencies Program, which has established a system for continuous event-based surveillance of public health events and the verification and assessment of detected events. Indonesia urged WHO to increase its role in facilitating the risk assessment and reporting activities of any health event that may be classified as public health emergencies priority, especially for member states with high vulnerability. The WHO health emergencies criteria should be widely understood and comprehensively recognized by member states. Indonesia, as a country with prone to public health emergencies, is committed to strengthen collaboration and cooperation with international community to develop community resilience and governance capacity to cope and to reduce the impact of public health emergencies. Honorable Chair, with regards to the agenda of implementation of the IHR 2005, Indonesia also would like to thank the WHO Secretariat for preparing the report. A global implementation plan for IHR 2005 is urgently needed as the threat and possibilities of disease continually spread across national borders and cross continents. Indonesia supports that developing new tools to assess the implementation of IHR for member states is a priority for WHO, since the framework has been recognized for its limitation to describe member states' capacity. Compliance rate for reporting among member states was considered low in the last recent years since the framework adopted in 2009. In 2015, Secretariat prepared a concept note, requested some input from member states. We request the Secretariat to provide information on the progress and status of this concept note. According to the 5-year Global Strategic Plan to improve public health preparedness and response and its assessment, WHO should take more attention and support member states for dissemination and internal process activities, as well as a process of evolving and adaptation for work plan, including simulation exercise and joint external evaluation. Finally, Indonesia, as a member of Global Health Security Agenda, continues its strong commitment for the full implementation of the IHR 2005 and continues its support to follow up result of the joint external evaluation that was conducted in November 2017. Thank you, Chair.
Thank you, Indonesia. I would now like to give the floor to Haiti, followed by United Kingdom. You have the floor.
Thank you, Mr. Chairman. Mr. Director General, ladies and gentlemen, my statement will concern documents 9 and 10. The spread of biological agents, which is a concern for all in the globalized era, can cause serious damage to human health. Therefore, the international health regulation mechanism should be the perfect means to provide exchange of information on epidemics and outbreaks. Health is priceless, and all countries can bring to the table their own expertise. My delegation would like to take this opportunity to stress the various approaches of Taiwan, a country in Southeast Asia, to put its vast experience
that in accordance with Rule 13 of the Rules of the Procedure, I would like to remind the Speaker to please refrain from remarks that are irrelevant to the subject under discussion.
Taiwan has been able to provide its reports.
Speaker again to please refrain and remain restricted to the topic under discussion. Please continue.
Mr. Director General, will this spirit of openness that you have promoted since your campaign to collaborate with various actors for universal health coverage, would that mean that Taiwan will be invited to take part as an observer in the 71st World Health Assembly in May?
Request once again to the honorable delegate from Haiti to please restrict to the topic under discussion. It's a very humble request.
Je vous remercie.
Thank you, Mr. Chairman.
Thank you very much, the honorable delegate from Haiti. I would now move on to the honorable delegate from United Kingdom.
Thank you, Chair. And in the interest of time, I will comment on all 3 papers. The UK welcomes the IOAC report and is pleased to see that it judges that WHO's performance in emergencies continues to improve. This reflects the evidence the UK has seen and the discussions we have had with partners on the ground. Clearly, performance, though, is not always consistent, and the improvements must continue. Coordination with partners, especially coordination with UNICEF as the lead for the WASH cluster, is a priority. As the IOAC notes, there is now a heavy responsibility on Member States to ensure funding for WHE allows improvements to continue. The UK is determined that we will not look back with regret should a lack of multi-year sustainable financing result in a WHO not able to mount a successful response to the next Ebola. The UK looks to WHO to provide the investment case for the emergencies programme and the replenishment strategy for the contingency fund that will demonstrate beyond doubt the value for money case for investment in the emergencies programme to save lives and prevent much more costly emergencies. Then, Member States and donors must step forward with funds. The UK looks forward to work with WHO and other Member States to enable the successful emergencies programme we have all committed to. Turning to paper 9, this paper lays bare the scale of the challenge WHO and its partners are facing in terms of health emergencies around the world. Often the world only hears of the most severe Grade 3 emergencies, but WHO and its partners are actively engaged in over 40 classified emergencies a year and investigate thousands of potential new outbreaks a month. The UK pays tribute to the frontline staff who deliver life-saving services. The responsibility at a global level is on WHO and its partners to ensure that the global humanitarian and health emergency architecture continues to reform to support operations on the ground. The UK would ask 2 specific questions on the health crisis in Yemen. First, this is clearly a complex situation, but one where collaboration between WHO as lead for the health cluster and UNICEF as lead for the WASH cluster has been less than optimal. What lessons has WHO learnt in this respect, and how will it use these to inform improved collaboration in Yemen in the future? Second, the cholera outbreak in Yemen, combined with concurrent cholera outbreaks elsewhere in the world, has resulted in significant pressure on cholera vaccine supplies. What is the WHO doing to manage the increased demand for cholera vaccine? Finally, on paper 10, the UK's view is that the WHO's focus should continue to be on implementing the existing international health regulations, which are essential to protect all people of the world from global health threats. And JEEs are a vital tool in assessing a country's success in implementing IHR and provide a useful basis for a strategy in a country improving its health systems. We welcome these papers. Thank you, Chair.
Thank you, the Honourable Delegate from United Kingdom. As mentioned earlier, as a chair of EB, I have to chair a couple of other meetings which are scheduled at 5:30 onwards. So I would request the Vice Chair from Fiji to please fill in for my place. Thank you. And the same agenda item would continue. Thank you very much. Thank you, Chair.
Thank you, Chair, and thank you for the opportunity to take over. So next intervention is from Switzerland, to be followed by India.
Monsieur le Président. Mr. Chairman, Switzerland welcomes this global strategic 5-year plan to strengthen the WHO's capacity and that of its member states in applying the IHR. As shown by the Ebola epidemic, all countries, and particularly those that are have the weakest health systems, have the minimal health systems. Concerning the second pillar of this strategic plan to strengthen the management of events, Switzerland feels that a technical directive by the WHO adapted to the different countries concerning the implementation of the IHR and the risks in the region could provide a significant added value, particularly in the international, with regards to the international air traffic. Member states would require the support of the WHO. We also take this opportunity to say that Switzerland in 2017 agreed to a joint external evaluation of the implementation of the IHR. Switzerland was very satisfied by this analysis. As it proposed, we support the statement in Annex 2 of 142.10. Thank you.
Thank you, Switzerland. I now hand the floor to India, to be followed by Nigeria.
Thank you, Mr. Chair. Our comments are for the three documents under consideration. The spate of recent global disasters has highlighted the need for greater public health preparedness. A robust health system is required to address the existing and emerging challenges. It was in May 2016, India had communicated to WHO regarding its status of compliance to IHR based on self-assessment of IHR core capacities. The implementation of IHR core capacities remains an important ongoing process. India complements the good work done by the WHO Health Emergencies Program, including the finalization of a global coordination mechanism for R&D. India would, however, request more information on the GCM R&D framework to help us better understand and analyze its progress. Mr. Chair, the focus of the strategic plan is on preparedness and response. Hence, it misses out on preventive strategies like immunization, biosafety, biosecurity, AMR, mitigation strategies like public health risk assessment and management, disaster-resilient health structures, and some aspects of preparedness strategies like health workforce development, medical countermeasures for certain hazards, R&D in context of public health emergencies. As the report primarily deals with health emergencies, India proposes that the agenda item could be rephrased as public health, emergency preparedness, and response. Inadequate finance still remains a major concern in the area of public health preparedness and response, particularly with respect to the underfunding of the contingency fund and the instability and inflexibility of tightly earmarking funding. Mr. Chair, India believes that for faster and more effective mobilization of resources in times of health emergencies, the country offices and the regional offices of WHO should be given sufficient resources and leeway in terms of contingency decision making. Mr. Chair, India will continue to commit itself and work with WHO in building up a robust, efficient and reliable public health preparedness and response system. Thank you.
Thank you, India. I now give the floor to the delegate from Nigeria, to be followed by Chile.
Thank you, Mr. Chairman. First of all, I'd like to say that Nigeria falls in line with the statement of the Afro region by Zambia. We also like to appreciate the Secretariat for their efforts. In the year 2017, like never before, Nigeria was faced with several outbreaks: cerebrospinal meningitis, Lassa fever, yellow fever, cholera, and towards the end of the year, monkeypox. The response to these outbreaks was led by the Nigeria Center for Disease Control, which is a parastatal of the Federal Ministry of Health. Nigeria received a lot of support from the World Health Organization, which we remain grateful for. For each of these outbreaks, NCDC activated its incident management system to coordinate outbreak response activities at the national level. We also prioritize the development of guidelines for monkeypox, viral hemorrhagic fevers, cholera, acute watery diarrhea, and cerebrospinal meningitis. In addition, to ensure accountability, a weekly situation report was developed for all large-scale outbreaks in the country and is available on the website of the NCDC. The government of Nigeria is grateful for the recent inclusion of Lassa fever on the WHO research and development list of priority diseases. The global attention on Lassa fever is of great importance to us in Nigeria as we continue to find more cases in our country. On the issue of the implementation of the international health regulations, Nigeria finally would just like to advocate for support in the area of financing of the IHR national action plans through mobilization of national and international resources for all countries. Thank you, Mr. Chair.
I thank the delegate of Nigeria. I now give the floor to Chile, to be followed by the Russian Federation.
Thank you, Mr. Chairman. I would like to mention document 10. Chile welcomes the presentation of the report on implementation of the international health regulations, and we fully agree with the proposals in it. Since 2017, our country has made a national proposal for the implementation and maintenance of basic capacities with regards to the IHR. Concerning the first pillar, Chile has a solid vigilant monitoring system. It is able to detect the threats and risks for public health. Every year we work to strengthen our technical teams, and we are therefore in line with what is included in the first pillar. We also feel that the most vulnerable countries require significant support from this organization, which will support the health of all regions. As concerns the second pillar, Chile has events monitoring through our focal points. We therefore verify the information received and assess the risks that may affect public health. With this mechanism, we have faced significant emergency events, such as the outbreaks of fevers. This requires information from PAHO and the WHO. Certainly, the strengthening that the Secretariat mentions for focal points will improve communication between WHO members. Lastly, as concerns the third pillar, our country collaborates every year with the WHO by sending the self-evaluation questionnaire, which helps us orient our work. Similarly, we have at various times expressed our participation in the joint external evaluation, which allows us to keep our national and international plans in line and adjusted to the international needs. With regards to we also engage in capacity evaluation for emergencies. Thank you, Mr. Chairman.
Thank you, Chile. I now give the floor to the delegate from the Russian Federation, to be followed by Peru.
Thank you, Chairman. We are speaking on all three documents. Firstly, the Russian Federation supports the efforts of the WHO to implement the IHRs and to respond together with member states to health emergencies. We thank the Secretariat for providing this report on the IHRs and the draft 5-year global strategic plan on global public health preparedness and response. We understand that it's not easy to find a balance and to take into account the positions of all member states when preparing such a document. Clearly, this has led to the result which we believe does not meet the task which was set for it. Firstly, the presented document does not have the signs of a plan. There are not clear measures, timelines, and with deadlines for implementation, those responsible for implementation, resources, and expected results. We are presented with 3 pillars, 3 strategic areas for action, and an explanation of what the Secretariat is going to do. By all signs, this is an internal document of the Secretariat setting out an approach to strengthening the capacity of member states to form their basic capabilities under the IHRs. Therefore, it is not clear why this should be endorsed by member states through a resolution. Moreover, the process of development of this plan did not fully correspond to the decision of the WHO, in particular at the Euro Regional Committee. There were no fully fledged consultations on the draft document organised. In its turn, Russia used all instruments it had to express its position and proposals on the plan. Thirdly, the position of Russia with regard to the JEE is consistent and clear. Unfortunately, we're not being heard. The instrument, the JEE, was developed in the framework of the donor of support by a small number of countries without harmonisation by member states, and despite the debatability of methodological approaches, is already broadly used in the WHO. The voluntary nature of the application of the JEE is only declared. A specific example is the obligatory use by the World Bank of the JEE for financing of countries in the framework of support for preparedness for pandemics. Therefore, we're against the formalisation of the JEE in official documents of the WHO, especially in the form of decisions of its governing bodies. A review overall of the monitoring and assessment instrument of the IHRs requires separate consideration, discussion by all member states, the organisation, and adoption by the Assembly, as is set forth in the rules. So, the EB and the Assembly cannot adopt a draft resolution in which there is a reference made to a revised monitoring and assessment instrument, which, according to the document EB 142 10 will only be prepared in June 2018. Therefore, we would like to inform the EB that Russia is reserving its position on the draft resolution. We suggest that in the remaining 4 months before the 71st session of the WHO, that a plan to be developed and a draft resolution, and that this current session of the EB takes note of the reports containing the draft plan. Referring the support of Russia to the activities of WHO and implementing the IHRs, I'd like to inform you about the decision of the government of the RF on continuing with its voluntary financial support for WHO to implement the IHRs. The next earmarked contribution, the agreement of which was signed at the end of 2017, is $4.3 million by the end of 2019, and it will be aimed inter alia at improving the monitoring and assessment instrument, building capacity and national focal points, and other important measures. Thank you very much.
Thank you very much, Russia. With apologies to Peru, we're changing the running order, so I'd like now to give the I do apologise. We're changing back. So I now give the floor to Peru? Yes. To Peru, I beg your pardon. Confusion. I'd like to invite Peru to be followed by China. Thank you.
Muchas gracias. Thank you very much, Mr. Vice Chair, for giving me the floor. We thank the Secretariat for preparing the documents on this agenda item. Peru is firmly committed to implementing the international health regulations. It's a legally binding instrument that helps the international community to prevent and to face the acute risks to public health that can cross borders and threaten populations throughout the world. We would like to highlight also the role of the organization in coordinating the response to health emergencies throughout 2017, as detailed in the report by the Director General. We fully share the idea that one of the major priorities of the WHO is in bringing together two related goals, health protection and at the same time promoting health through universal health coverage. A strong health system will be the best defense to prevent the outbreak of a disease becoming an epidemic. Lastly, we would like to highlight several actions carried out in my country with regards to implementing the IHR. Approval of a plan to improve basic capacities and monitoring and response that has includes an annual self-evaluation report. The framework of with regards to the framework of the global health system security agenda, we have carried out evaluations. In Peru, we've created a multi-sectoral commission that has as its goal to follow up on the national implementation of IHR. And we have improved partnerships with academic institutions and international foundations to strengthen health capacities. And we also have a strong commitment to, at the highest political level, to expand access to clean water and sanitation, which will certainly have a impact on vector-borne diseases particularly. Thank you very much, Mr. Chairman.
Thank you, Peru. I now give the floor to China. Thank you.
Deputy Chair, the Chinese delegation respects the requirement from the chairman that any statement should be relevant to the topic under discussion. We will make substantial interventions. At the same time, for certain countries who have made Taiwan-related comments, we'd like to make statement of our reply. Some countries have made statements on issues related to China's Taiwan. We'd like to make statement of reply.
You making your distinction between substantive comments and the right of reply. Could I ask, and understand in accordance with the rules of procedure, if we could take your substantive comments on the agenda item now, and then we're very happy to take your comments in reply to other member states at the end of this agenda item 3.3, if that's acceptable. Thank you.
是的，谢谢副主席先生。
Yes, thank you, Deputy Chair. Vice Chair, the Chinese delegation would like to thank DG's report on public health preparedness and response, and also the report on the implementation of HR 2005. We highly appreciate WHO and relevant countries for their continued and consistent efforts for the implementation of HR 2005. In principle, China agrees with the 2018 to 2023 draft global strategy for the actions of public health preparedness and response, and also the draft on decision. Chinese government attaches great importance to the implementation of HR. NHFPC had led a cross-sectoral efforts to build the core capacities according to HR. We have also made proper monitoring, evaluation, assessment, and reporting based on HR's requirements. Each year, we have an annual domestic assessment, internal assessment for our implementation, and make reports accordingly. We've noticed that globally, emerging diseases have threatened people's health. Some major emergencies may have also occurred from time to time. China has been putting people's health first, and we emphasize on the building of the common destiny for the entire mankind. That's why we have put forward the following 2 points of suggestions for the implementation of HR 2005. First, give more support to fragile and vulnerable countries so as to build their core capacities. We hope these vulnerable countries can have a stronger health system with better monitoring capacity. Second, between 2018 and 2023, during the 5 year of the global strategy, the revision of the global strategy should also be in alignment with the HR 2005's implementation, so as to provide convenient and feasible support to the preparedness and response across the world. Thank you, Vice Chair.
Thank you for your understanding. I don't see any more member states seeking to take the floor. So now I would like to move on to one observer and give the floor now to Palestine. Thank you.
شكرا سيدي الرئيس.
Thank you, Mr. Chairman. Mr. Director General, ladies and gentlemen, good evening. This Palestine statement concerns document 142/9. Palestine aligns itself with the IMRO group, to which we belong, which presented a statement by Bahrain. We hail the efforts of the Secretariat to prepare these reports on public health and preparedness, as well as the effective role that the WHO plays in facing health emergencies. We would like to make 3 points. First, we see no mention made of the emergency health situation in Palestine and in many countries of our region, EMRO, which are experiencing instability due to crises and war. My question is, does the occupied Palestinian territory, have they experienced no health or humanitarian crises? Gaza has a problem of electricity, which is necessary to have the health instruments functioning, for example, even dialysis. We have electricity for only 6 hours per day, and we must use generators in addition to that. And we use those based on fuel. Certainly, the freedom of movement is limited due to Israel's actions, and this worsens the humanitarian crisis in the region. All of this is proof of a health and humanitarian crisis in Palestine, and this should be included in your upcoming reports, in line with the principle of leaving no one behind, and in line also with the SDGs. You are in direct connection with the Ministry of Health in Palestine. You know very well what is happening there and in the occupied territories. Second, Palestine within the United Nations has a reserve. I would like to express reserves on this report because despite our request to correct our name in the recent reports by the Secretary of the Occupied Palestinian Territories, this is included in the report on health crises in the Gaza Strip, the West Bank, the Golan Heights, and Gaza. All of these names must be corrected in this report in compliance with the UN resolutions, particularly the resolution by the World Health Assembly 5313. Mr. Vice Chair, thirdly, Dr. Tedros, the occupying Palestinian state, reaffirms its full commitment to your mandate and your access to the Director Generalship, and we commit to collaborating together with the WHO to find solutions. Thank you.
Thank you, Palestine. We have one non-state observer who wishes to address the meeting, and that is IFRC. I give the floor to IFRC. Thank you.
Thank you, Chair. Our intervention is in reference to all three documents. The IFRC would like to commend the work done by all stakeholders on improving public health preparedness and response in 2017. And we would especially like to highlight the improved coordination and sharing of information among stakeholders that has led to improved response on the ground. We reiterate our commitment to ensuring effective and efficient coordination between our complementary response mechanisms and that of the WHO's, as well as other actors. The National Red Cross, Red Crescent Societies and IFRC, alongside key partners, have played important roles in the majority of emergencies listed within the WHO's report on work in health emergencies, where volunteers and staff are present within communities before, during, and after crisis, contributing to preparedness and response at the community level. As noted in the 2017 resolution of the Council of Delegates of the International Red Cross and Red Crescent movements, the IFRC and our national societies have committed to strengthening effective community engagement in disease outbreak, prevention and response. This is because we believe that epidemic preparedness and response starts and ends with communities. And without the inclusion of community-driven efforts, government actions can be delayed and potentially less effective. Through our networks of volunteers across 190 countries, where we are able to serve the most vulnerable and hard-to-reach populations, even when the international humanitarian community may have no or limited access. Moving forward, we stand ready to support national action plans and efforts towards developing IHR capacities for emergency preparedness and response, assessment, planning, and implementation. Finally, we take this opportunity to highlight three key points. Firstly, we are particularly pleased to see the importance given to community involvement and partnerships in the WHO strategic plan, including partnerships with local civil society organizations and community-based organizations. However, collectively, we need to ensure that we continue to expand IHR core capacities at the community level, ensuring communities remain at the center of preparedness and response efforts. Finally, we'd like to stress the importance of the rapid identification and declaration of health emergencies, and we encourage donors to support early response actions. Thank you.
Thank you, IFRC. I believe there are no more member states or observers wanting to speak on EB 1428. I do remind you that we have thus far only been technically speaking on 1428, but many speakers took the opportunity, as was offered, to speak on all three papers. So that brings us to the end of our consideration of EB 1428. We would now like to consider the report entitled WHO's Work in Health Emergencies, which is document EB 1429. I'm anticipating there will not be too many comments given how many speakers chose to speak on all three papers previously. However, I invite any comments on any interventions in respect specifically of EB 1429. And sorry, and again, just to clarify, we will come back and respond and note all the reports at the end of this item. So in respect of EB 1429, I'd now like to give the floor to the delegate from Netherlands. Thank you.
First of all, I would like to thank the Secretariat for its report. It's very helpful that we receive for every board meeting a comprehensive report on WHO's work in all the emergencies where it is involved. From the report, it becomes clear that the tasks of the new health emergencies program are huge. It is impressive to read how many signals WHO receives and in which ones WHO is closely involved. The Netherlands is pleased with the results of the new program so far. We commend the Secretariat for its successful work in dealing with the plague outbreak in Madagascar and Marburg virus in Uganda. We are pleased to note that the Contingency Fund has played an important role in responding quickly. Having said this, we are aware that WHO is involved with quite some emergencies and humanitarian crises that need, unfortunately, a much longer involvement of WHO. In this respect, I would like to hear from the Secretariat how it benefits from CEF at this stage. WHO makes good progress with the implementation, like with the new incident management system. However, we are aware that there are still quite some obstacles and constraints that need to be tackled. We see the financial constraints of the program, although we have the impression that the situation has improved since the start. How does the Secretariat see this? When you read the report, it is clear that the health emergencies, where the health emergency program is involved, vary a lot, from outbreaks to war, from displaced people to natural disasters. In all these crises, more than 26 million women and girls of reproductive age are in dire need of humanitarian aid, including sexual and reproductive health services. These services are often lacking. This illustrates, and we have said this earlier also during this session, this illustrates the need for extra attention in the GPW for sexual and reproductive health and rights. To show the Netherlands' commitment, we announced last week to support WHO with an extra $5.5 million to make sure that sexual and reproductive health and rights services are included in the health cluster response in Yemen, DRC, and Bangladesh. Thank you.
Thank you, Netherlands. I see no more comments on 1429. Let us now consider the implementation of the International Health Regulations Draft Strategic Plan, which is contained in document EB 14210. So again, I invite any comments wishing to address EB 14210. I see. I give the floor to Malta, to be followed by Brazil.
Thank you, Chair. I'm speaking on behalf of the European Union and its member states. The candidate countries Turkey, the former Yugoslav Republic of Macedonia, Montenegro and Albania, the country of the stabilization and association process and potential candidate Bosnia and Herzegovina, as well as Ukraine and Georgia, align themselves with this statement. We thank the Secretariat for this comprehensive and clearly structured report and the draft 5-year implementation plan. Full implementation of the international health regulations and well-functioning health systems, as well as maintenance of critical health infrastructure, including in high vulnerability, low-capacity countries at greatest risk of emergencies and outbreaks, are the core of an improved global health security. This creates synergies on the path to achieve universal health coverage. Thus, we would like to recall the legitimacy and binding nature of the IHR and the importance of the national focal point network. All member states share responsibility to their own populations and to one another to fully implement the IHR and to develop their health system capacity for detection, preparedness and response with support from WHO and with other partners. We agree with the goals, objectives and pillars of the draft 5-year implementation plan. We particularly welcome the link made between core capacities buildings and public health system strengthening. We look forward to the development of the conceptual framework for harmonizing core capacity requirements with national health systems and essential public health functions. We expect the WHO Health Emergency Programme to closely work with the health systems and UHC cluster. We welcome the support provided by the Global Outbreak Alert and Response Network through the provision of a pool of human and technical resources to strengthen the WHO management of emergency response and preparedness. We would like to highlight the importance of the new voluntary monitoring and evaluation instruments and encourage their use as an input to the development of national action plans for health security integrated in and aligned with national health strategies. These instruments help countries to list priority areas to accelerate the implementation of IHR core capacities. WHO's support is essential in this context, in particular for training the IHR national focal points and other key players. Strengthening implementation of IHR is crucial to achieve the proposed impact of the new General Programme of Work, to achieve SDG 3, and above all, to keep the world safe from global health crises. To do so, cooperation and coordination of activities with regional organizations such as the EU is essential. We are working towards the full implementation of the IHR through obligations under the EU decision on serious cross-border threats to health and its cooperation programs, including assistance via the European Medical Corps. We are ready to work closely with WHO regional offices and the WHO office in charge of preparedness and capacity building in this regard. Recognizing the importance of IHR as a component of an efficient health system, we, when asked to by partner countries, are willing to accelerate the sustainable implementation of IHR through our bilateral development cooperation. The EU and its member states are ready to endorse the 5-year implementation plan, as in the Annex 1 in document EB 142/10, and call on the EB to adopt the draft decision contained in the report. Thank you.
Thank you, Malta. Could I just at this stage draw everyone's attention to the clock? You'll recall that we are working through to 6:15. I'm sure we're all very keen to try and finish this agenda item today. We still have a number of speakers, so without wishing to suppress debate and discussion, if I could encourage those remaining speakers to perhaps consider curtailing their addresses, keeping them brief, we may well still achieve our objective. So with that in mind, I would like now to give the floor to Brazil, to be followed by Sweden. Thank you.
Thank you, Chair. Do my best to stick to your guidance. But we think, as also the report containing the draft 5-year global strategic plan to improve public health preparedness and response, to guide actions directed to enhance the implementation of the IHR from 2018 to 2023. Brazil notes with satisfaction that principles such as consultation and country ownership were, as decided during the last World Health Assembly, duly taken into account into the plan. One of the critical governance issues of the IHR is the monitoring of its due application, implementation, and compliance. From our perspective, monitoring and evaluation of progress on IHR implementation is central to the proper follow-up and continuous improvement of implementation activities at national, regional, and global levels. In order to strengthen the IHR and to propose a way forward in relation to its monitoring and evaluation framework, Brazil held in São Paulo last July the formal regional consultation on the IHR. Additionally, the discussions during the 29th Pan-American Sanitary Conference last September invited member states to review the guiding principles and pillars of the 5-year Global Strategic Plan and to provide their views on the IHR monitoring and evaluation framework. In this regard, Brazil believes that there are some questions related to the 4 components of the monitoring and evaluation framework that still require further guidance. Among those, I would like to highlight one, and it is how the information produced by the application of the specific component will be used by the WHO Secretariat to inform its country cooperation activities. And finally, we understand that submission to these evaluation tools are not to be considered as a requisite or advantage for a member state to have access to funding or technical cooperation. Thank you.
Thank you very much, Brazil. I now give the floor to Sweden, to be followed by the Netherlands.
Thank you, Chair. I'm speaking on behalf of the 8 Nordic and Baltic countries: Denmark, Estonia, Finland, Iceland, Latvia, Lithuania, Norway, and Sweden. We commend the Secretariat for its work on developing a draft 5-year global strategic plan based on lessons learned from the Ebola outbreak and recommendations made by several expert groups. The leading role of the Secretariat in the consultation process has been important. We support the draft plan as outlined in the report. We appreciate the focus on building and maintaining resilient health systems and on framing core capacities as essential public health functions of health systems. Country ownership is crucial. We also acknowledge the need to prioritize high vulnerability, low capacity countries at greatest risk of emergencies and outbreaks. The annual self-assessment reporting tool has an important role in providing a comprehensive picture of the implementation of IHR. We welcome the ongoing work to revise this tool and support an expert-level consultation on the result. We agree with the plan to present the revised self-assessment reporting tool to states parties through the governing bodies for information. The additional voluntary instruments are crucial to step up national implementation of IHR by identifying gaps and needs, leading to the development of national action plans for preparedness and to measure progress. The need for funding will become clear as gaps in core capacities and health systems become evident through evaluations. WHO needs to enhance its support to countries for leveraging financing, partnerships and technologies to support IHR implementation. WHO must also ensure that response activities and investments during health emergencies are linked to long-term preparedness and health system strengthening, including sustainable development of IHR core capacities. We trust the Secretariat will develop a concrete implementation plan for the follow-up work. WHO's continued leading role in this work is crucial. Finally, Chair, we support the draft decision as presented. Thank you.
Thank you, Sweden. I now give the floor to the Netherlands, to be followed by Fiji. Netherlands, you have the floor.
Thank you, Chair. The Netherlands aligns itself with the statement made by Malta on behalf of the European Union and its member states. In addition, I would like to make the following remarks. Effective implementation IHR is crucial for global health security, but effective information about IHR implementation as well. state parties and the Director General report annually to the Health Assembly on the implementation of the regulations. We have received this reports every year. What do these reports tell us? To quote the 2017 report, and I quote, as of 28 February 2017, 120 of 196 state parties had completed the questionnaire sent in July 2016. Globally, progress has been made since 2010 across the 13 core capacities required by the regulations, particularly in surveillance, response and zoonosis. But the overall average scores suggest further efforts are urgently needed in the areas of human resources, capacities at points of entry, chemical events and radiation emergencies. End of quote. This was all. What does this tell us? It informs us that unfortunately a huge number of parties doesn't inform WHO, and it provides us with little information about the challenges. Of course, the Secretariat is handicapped with information resulting from self-assessments. So we expect more information from the external evaluations. However, the Netherlands would like to see a much more in-depth and strategic conclusion of IHR implementations. Where are the big challenges and what are the risks of non-implementation? This concerns us all. Of course, we understand that the Secretariat doesn't want to name and shame, but we would like to see in this year's report to the Assembly a much more detailed conclusion. Can the Secretariat provide the Assembly this? Thank you.
Thank you, Netherlands. I now give the floor to Fiji, to be followed by New Zealand. Fiji, you have the floor.
Thank you, Chair. Fiji thanks the Secretariat for working to ensure that the draft Global Strategic Plan aligns with and is a complement to existing plans for IHR implementation, including the Asia-Pacific Strategy for Emerging Diseases, or ABSED3. We also welcome the adoption of the 3 pillars of the draft global plan. With respect to Pillar 1, we support the development of a common framework for harmonizing the core capacities required under the IHR with the essential public health functions of health systems. Fiji notes that small island developing states may face particular challenges, firstly with increased vulnerability to public health emergencies in the form of natural disasters, and then in responding to public health emergencies due to remote geography, scarce human resources. Often the same staff are involved in preparedness and planning, prevention, response, and recovery, and difficulties in establishing and maintaining certain IHR core capacities, for example, laboratory diagnostic and confirmation capacity. We agree with the recommendations of ABSED3 and the Pacific Health Security Coordination Plan that core capacities in small island developing states could be achieved through the regional pooling of resources. We believe that WHO could play a key convening role in supporting the pooling of resources, especially in the development of regional reference laboratories. With reference to Pillar 2, we support capacity building of national IHR focal points, but we share the concerns of the delegation from Thailand with the monitoring and evaluation tool for this pillar. And we specifically suggest including number of trainings as one of the indicators rather than just number of meetings. We also support strengthening national public health emergency operation centers, but note that this is not reflected in the monitoring and evaluation framework of this global plan. We recommend the inclusion of an appropriate indicator in the monitoring and evaluation framework. With reference to Pillar 3, we support the addition of 3 voluntary assessment instruments, but recognize that member states with limited resources will continue to require support for their participation, especially in the case of the JEE, which can be an extensive and costly exercise. In short, Fiji considers IHR to be a whole of government responsibility and not solely a matter for the health sector. Indeed, health security should be a key component of overarching national security strategies, with IHR implementation as a national priority. In conclusion, Fiji supports the draft decision set out in Annex 2 noting in particular the request to the Director General for support to Member States in operative paragraph 2C. Thank you.
Thank you. Thank you, Fiji. I now give the floor to New Zealand.
Thank you, Chair. We note the progress made on the 5-year Global Strategic Plan and appreciate the Secretariat incorporating recommendations made during regional committee meetings and the subsequent consultations. We have 3 specific questions for the Secretariat today. Number 1, Pillar 2 and paragraph 21 discuss strengthening technical capacity by establishing and maintaining relevant technical advisory groups of experts. Has the Secretariat looked into the value of existing groups, whether they should continue, and whether any new advisory groups are needed? Number 2, paragraph 17 discusses maintaining a strong network of national IHR focal points by holding regular regional and global meetings to build capacity and share lessons learned. Has the Secretariat considered other means of sharing lessons other than regular meetings? For example, the online health security learning platform. Number 3, in Appendix 3, which outlines the deliverables, timelines and indicators to monitor implementation of the plan, as referenced by Thailand and Fiji also, we consider that the indicator framework remains largely focused on monitoring outputs, such as number of different meetings held. As the strategic plan overlaps with the timeframe of the new GPW, and given the vision for WHO moving forward, has the Secretariat considered moving towards outcome or impact indicators in order to align? We think the approach outlined in the strategic plan for strengthening core capacities is sound, and we look forward to seeing the strategic plan and the decision being taken forward to the Assembly.
Thank you, New Zealand. I see no further EB members wishing to take the floor, so I would now like to give the floor to the delegate from Argentina. Argentina, you have the floor.
Thank you, Chairman. Argentina takes note of this document and thanks the Secretariat. We would like to know why, following 3 years of consultations on the framework for evaluation, this is now being considered again by the EB, in line with what was said by the Regional Committee for the Americas and reiterating the statement by our country in various consultation bodies. We believe that discussion on the follow-up and evaluation framework for the IHRs should be taken up and included in a separate document from that on the 5-year strategic plan. Moreover, both should be independently considered for consideration at the WHO's governing bodies for their consideration and decision. We believe that all the new follow-up and evaluation and report presentation procedures should be submitted for consideration by member states. With regard to deliverables, timelines, indicators for follow-up on implementation of a draft 5-year global strategic plan, we believe that what is required is greater clarity and correspondence between the objectives mentioned, the deliverables, and the indicators proposed. Finally, we'd like to highlight the importance of strengthening national focal points for IHRs and the need to continue to hold meetings and undertaking periodic regional and global training courses. Thank you.
Thank you, Argentina. Well, you will see that the clock has got the better of us, so we will now draw to a close and suspend discussion of this item until tomorrow. Just to remind everybody, the sequence tomorrow morning, starting at 9 o'clock, we have a number of non-state actors who wish to speak on these items. We'll then have a response from the Secretariat. We'll then consider the draft resolution in Annex 2, and then, as indicated earlier, we will allow China to exercise their right of reply to comments made by other member states. So that draws us to a close. Thank you all for your participation. Thank you, as always, to the interpreters. And we reconvene at 9 o'clock sharp tomorrow morning. Thank you very much.